Okay, and we have begun. All right. Good morning, everybody. Welcome to the third lecture of our injury and rehabilitation series of lectures. Today, we're going to be discussing about disc herniations. Before we get started, out of all of you here, just let me know if you guys have ever personally experienced a disc herniation or personally worked with anybody with a disc herniation, or like for yourself, or as a coach you've helped somebody with this. So I just wanted to know your have you guys been with anybody like that or experienced it with yourself? Anybody? Okay. Anybody else? Just say no if you guys haven't. So basically, the guys who just joined, I asked if any of you guys have personally experienced a disc herniation or at least have worked with someone with a disc herniation. Nobody. Okay, cool, fine. I mean, that pretty much says a lot about it. That it is, it's actually a pretty common thing to happen to a lot of people, but it's not. It's very rarely very serious. So we will discuss a lot more about it as we go ahead. So you will, without further ado, let's just move right into it. So this is basically how I've broken down the lecture. Okay, we'll be starting with the structure and function of intervertebral discs and all the components and everything. We'll understand it very well. Then we'll start going into what exactly is a herniated disc. There are certain stages and things like that. Then we move into the biomechanics, how the spine works, and what might get compromised given there's a disc bulge. Then we would go into healing and movement, and then finally we'll touch on a little bit on sciatica because it tends to come under this umbrella as well. Take care. Awesome. So, one second. So, structure and function. All right. Basically, this is just part of your spine. This is your spinal column. ये जो है is just your spinal column, and basically the blue thing that you see in between it is just your spinal disc, and that is the main thing that we're talking about today. All right. Just wanted to touch on that. Very, very basic stuff. So it is dissected into two, um, basically two areas. You can see the whitish, more outer layer of that disc is called the annulus fibrosus. And then we have an inner darker circle, which is known as the nucleus pulposus. All right. So we have an outer layer, which is lighter in color. And then we have a darker layer, which is more inside. Now, why they are so, we will also learn ahead. Okay. Then there is a very small thing that uh, is basically covering that entire disc, and it is the end plate, is what we call the end plate or hyaline cartilaginous end plate. So you can already make out that it is pretty like it's made with cartilage, right? This also basically is part of the entire disc, and as you can read, it also helps to bring in some force transmission whenever you're doing any particular exercise, and it also very importantly helps with nutrient transmission, which again we will be diving deeper into. So this is just basically it. We have several vertebral columns in our spine, and within each of them we have these discs. The outer layer is the annulus fibrosus, inner is nucleus pulposus, and then we have the cartilage end plate, which is surrounding it. Okay. Um, so basically, this is our spine, and what is highlighted in the picture is your cervical area. You will notice that in C1 and C2, between them, there is no disc, right? And that is just unique to our spine, the human spine. We have 23 total discs. Six of them are cervical, uh, and 12 of them are thoracic, which is the middle portion, and then you have 5 which are lumbar, which is the bottom portion. And then we have, like, basically I think there are around 33 vertebrae, and then I mean, it kind of forms the entire thing. Even that small at the very end, you can see this, which basically curves that tailbone. That is all basically, I think, 3 or 5 vertebrae just fused together. So yeah, and so is the C1 and C2 is also kind of fused together, so they kind of move with each other, and that is something that is unique to our body. Now, if we did not have these discs, अगर हमारे स्पाइन में ये जो डिस्क है वो था ही नहीं, ठीक है, तो फिर what would happen? Basically, only linear motion would be possible. Linear basically just means only straight, मतलब एक ही movement, ठीक है, कुछ change नहीं है. तो we wouldn't be able to, do flexion, do extension. We would just basically be rigid. I mean, you can just imagine two vertebral bones. अगर ये ऐसा bone था, इस बीच में कुछ नहीं था, तो it'll feel like it's very rigid, it's not able to move well. अभी अगर डिस्क है अभी, now it's like a whole, like a cushion, right, basically, so it's giving its nice movement here and there, so we can also move around, so it's providing movement, right, it's providing as a pivot point. So the vertebrae columns jo hai are is basically using that disc to move around and give us our this thing, movement. Then we also have many, many other vital functions. All right. Now, in a way, the discs are providing movement, but they're also resisting movement. We will learn more about that, which is why our spine is able to maintain that stable form. And you will notice that to some degree it is flexible, but to some degree it is also not. So it's kind of in between, like it kind of resists motion as well, but it also provides a little bit of movement, right, as much as we require. So it's like perfect, right? Then it also obviously helps protecting the spine. If you would see in this, basically this bigger here, this is the posterior end, which is are behind here, right? We can feel all of these bones here. That these are basically these big ones here, and these are called facets. In between them, there's a hole, basically, which is our spinal cord is just traveling through. So we also need to maintain that, right? Otherwise, it will basically just cause all chaos. So to maintain that shape of the spine is also what we're calling. So, and of course, we also know shock absorption whenever we're jumping and doing high impact activity. It is helping to take care of that blow so that our spinal vertebral columns are all intact. Okay. Let's move on. Now we'll be diving a little bit more deeper into this. Okay, now this is the annulus fibrosus we'll be referring to as AF. Okay, without, just to keep it very simple. So that, which is the outer circle, right? The more whiter part, basically compromised more of type 2 collagen. Now there's a many types of collagen. बहुत सारे collagen के types है. Type 1 to type 6 भी है, बहुत सारे ऐसा. But this is majorly comprised of type 2. और type 2 जो है is more rigid. ठीक है, it's more rigid, and it basically provides a lot of, so you can even see that it provides a lot of tensile strength. ठीक है, तो अगर strength है, right, you might have, we were also discussed this in previous, so anytime there's a joint which is very, very flexible, very, very mobile, right, it is more prone to injury, right, because it is unstable. So you kind of have to sacrifice some of the other, right? You have either like really good stability and strength, but you don't have a lot of mobility, right? Or you have a lot of mobility but you don't have a lot of stability. So it's like a trade-off. So over here, the annulus pulposus is, the primary function is also to kind of maintain that rigid form, right? कि ये जो spine है ऐसा 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 नहीं जाना चाहिए, right? It should be थोड़ा strict. So the annulus pulposus is, sorry, the annulus fibrosus or AF is more of type 2 collagen, so that it remains basically rigid, right? And it's also strong enough, टेंसाइल स्ट्रेंथ चाहिए उसको, क्योंकि वो जो न्यूक्लियस पल्पस है जो अंदर है इज मोर लाइक अ जेल लाइक स्ट्रक्चर. तो वो नो उसको कंटेन रखना है, सो लाइक कीप इट इनसाइड, बिकॉज व्हाट हैपेंस इज दैट जेल इज लाइक, इट्स लाइक, फॉर एग्जांपल थिंक ऑफ इट लाइक वाटर, राइट? इट विल जस्ट कम आउट लाइक हाउ यू विल बी talking into the herniated disc, so it's trying to keep it inside there, right? So it needs that strength. तो इसी के वजह से there's more type 2 collagen here and less of proteoglycans. Now, you can notice that there are a lot of circles in that annulus fibrosus, So the more further you go away from the nucleus pulposus, there'll be more type 2 collagen and less proteoglycans. And as you move more forward towards the nucleus, you will see there are more more proteoglycans and less type 2 collagen. Why? We will see now on the next one, which is the nucleus pulposus, right? NP. इसमें जो है, here there's a major amount of water, right? If you see in the previous one, there's only 30-60% of water. Here, there's 60 to 85% of water, which are, like I said, it's like a gel-like core, right? Now, here it is mainly type 2 still, but it is mostly like type 1 here and there, mostly on that side. And proteoglycans are very, very rich over here. Now, why proteoglycans are rich? Simply because proteoglycans are basically just another protein and they are very hydrophilic, right? Hydrophilic meaning they attract water a lot. So, which is also why this particular area has a lot of water, right? And over here, because it has a lot of water, because it's a little bit mobile, it provides elasticity to the spine, right? So annulus fibrosus was more like rigid and providing form. It's like, a strict monitor, whereas nucleus pulposus is providing a little bit of movement, providing a little bit of, that elasticity for the spine can move, and also some freedom of movement, so that even in impact, it is taken care of. Because if something is too rigid, it doesn't have a lot of shock absorption, right? But if something has a little bit of movement, right, just like in our cars, right, we see the springs, they have a little movement. Is that whenever we hit basically a pothole, the car basically just like has bounces, right? So we need that elasticity to be able to shock absorb, right? So both the nucleus pulposus and annulus just like work together to provide all of this movement that we have in the spine, and also obviously the rigidity. All right. So far till here, any questions at all? Just give me a thumbs up if you guys are cool. Okay. Tell me, Tariq, what did you not get?
No, no, I mean to say there is no question.
Okay, fine. Got it. Let's move ahead then. So basically, this is one topic I would like to touch on, which is called hydrostatic pressure. So इसमें क्या है ना जो if you look at in the picture in the nucleus pulposus, you can see वो जो pressure is basically pushing it out. So that is basically what happens is when there is any loading to the spine. ठीक है? When there's any loading to the spine, the nucleus pulposus, the water in it, basically gets like under tension, and so it pushes out, right? It wants to go out because there's, I mean, imagine, I mean, the usual typical this thing that they give is the jelly donut analogy, right? अगर आपके पास एक donut है, ठीक है, donut के अंदर ऐसा jelly है, आपने ऐसा just you squeezed it and the jelly just came out, ठीक है? So similarly, when you're compressing your spine, that gel-like structure just wants to move out, but it moves out uniformly, right? Everywhere. So that pressure is built in that basically in that disc. And what this disc does is, because of that pressure, it also is like a little stable, so it provides like uniform stability throughout the disc, right? So that way it also helps that there is no like one place which is like shorter or longer, like it tends to be very rigid. So that is why the jelly donut analogy may not be very accurate, because wherever you squeeze it, you it kind of just like squeezes. But if you were to squeeze a disc, it would actually fight back. So it has some tensile, some buoyancy, I guess I would say, or maybe some rigidity to it, right? So it is not just like something that's too soft. It has some fight back here and there. So it's like pretty rigid, but also a bit flexible and elastic. So this is just something I wanted to touch on, right? This obviously also helps with a lot of things, like providing nutrition to the disc, which you will come to know ahead. All right. So over here is now we're going to be touching upon the vascularity and basically how this disc is able to stay healthy and perform its functions and things like that, right? So one of the biggest issues here, first of all, is that it is avascular. What does that simply mean? Is that it does not have a lot of blood vessels, right? Directly to it, actually doesn't even have anything directly to the disc. Okay. uh, in the picture you will see that there's the purple picture, right? जो पर्पल कलर जो है वो डिस्क है, ठीक है। और जो सारे रेड रेड कलर के लाइंस है वो बेसिकली आर द ब्लड वेसल्स यू कैन थिंक अबाउट, ठीक है। तो यू नोटिस जो ब्लड वेसल्स है वो जो येलो कलर का लाइन है विच इज बेसिकली द एंड प्लेट, जो हमने स्टार्टिंग में हमने बात किया था, वो उधर तक वो पहुंचता है और उधर तक एंड होता है, ठीक है। उसके आगे नहीं जाता है। तो वो जो डिस्क है उसके अंदर इज बेसिकली नॉट गेटिंग एनी ब्लड सप्लाई फ्रॉम देयर। इट द ब्लड सप्लाई एंड्स एट द वर्टिबल एंड प्लेट, ठीक है। Which is why we say that the discs are avascular. So um, even if they need some nutrition directly from the blood side, it will not happen. So how do they get it? Is just something known as diffusion, okay. And this requires movement basically. So whenever we, like I said, the movement, the hydrostatic pressure basically, so all that movement is basically just providing that diffusion to happen. And diffusion is, इफ आई डू इट इन सिंपल टर्म्स, ठीक है, सोचो आप बर्तन धो रहे हो, ठीक है। आपने वो स्पंज लिया, ठीक है। जो जब भी आप स्पंज लेते हो, व्हेन यू स्क्वीज इट, ऑल द व्हेन यू आफ्टर यू वाइप बेसिकली द बर्तन, राइट, the whole sponge gets dirty. So you squeeze it and all the dirty water comes in, but then you refill it again, right? Because now when it's squeezed, it is ready to reabsorb some water from like the clean water. That is exactly what is happening here. So whenever we compress, जब भी we gravity, weight, whatever is happening, spine compress, जब भी वो compress हो जाए तो ये जो डिस्क है compress होके वो जो भी मेटाबोलाइट्स है, वेस्ट प्रोडक्ट्स है, वो बाहर निकलता है। और जो भी उधर व्हाटएवर इज प्रेजेंट आर न्यूट्रिएंट्स लाइक ऑक्सीजन और ग्लूकोज, जो भी उसको चाहिए वो फिर अंदर जाता है। तो बेसिकली डिफ्यूजन, सो जो जो हमको नहीं चाहिए वेस्ट प्रोडक्ट्स वगैरह वो बाहर निकलता है। और उसी के साथ द वंस वी नीड लाइक ग्लूकोज एंड एनर्जी एवरीथिंग कम्स इनटू द डिस्क बाय डिफ्यूजन. So that movement is required. So just keep that in mind, right? That because these are not vascular, we don't have direct uh, you know reach of blood supply into it. We need this diffusion happening, we need this pressure, we need this movement to provide um, nutrition to this disc. Okay, now we will go ahead. This is the next section. So until then, is everybody fine? I think somebody wanted me to do a quick summary. Okay, fine. So बेसिकली दिस इज योर स्पाइनल कॉलम, ठीक है। आपका जो है एक वर्टिब्रे है, जो आपका स्पाइन है, वो जो ऐसा बोन्स आप फील करते हो, दिस इज वन ऑफ दोस, ठीक है। वो जो स्पाइन के वर्टिब्रल कॉलम्स के बीच में एक डिस्क है, हम उसको हम इंटरवर्टिब्रल डिस्क बोलते हैं, ठीक है। उसके अंदर बेसिकली देयर आर, वी कैन डिवाइड इनटू टू कैटेगरीज और टू पार्ट्स बेसिकली। वो जो बाहर का आउटर लेयर है उसको एन्युलस फाइब्रोसिस कहते हैं, उसको जो अंदर है इज कॉल्ड न्यूक्लियस पल्पसिस, ठीक है। um, and in that disc on top here, these are called the end plates, a very very thin um, area over there. It's called a hyaline cartilaginous end plate, okay. Fine, then these so this is like just some basic knowledge. Okay, there are 23 discs in the spine, 6 cervical, 12 thoracic, and I think five lumbar discs, okay. This is basically what we talked about, is that if our डिस्क, अगर हमारे पास डिस्क नहीं होता तो हमारा स्पाइन कंप्लीटली रिजिड होता, ऐसा हम जो बेंडिंग और मूवमेंट करते वो कभी होता ही नहीं था, ठीक है। दैट इज बेसिकली व्हाट दिस स्लाइड इज ऑल अबाउट. Then we dive deeper into what annulus fibrosis is. It is the outer that jo of the what of the disc basically, and it is more of type 2 collagen. Sorry, type 1. Yeah, okay, type 1 collagen. I think I may have messed up that. So please just um just bear with me, okay. I think I messed up that part. So yeah, type 1 collagen, all right, it has more of type 1 collagen and less of proteoglycans, which makes it more rigid, and which is needed because it needs to provide that structural integrity, right? अगर हमारे spine ऐसा ऐसा टुकड़ा वो बस, it basically falls means it will not be able to provide that stability. और stability चाहिए तो इसलिए annulus fibrosis is maintain that stability over there, and it's also trying to contain that nucleus pulposus in. तो उसको strength चाहिए, ज्यादा mobility नहीं चाहिए, बस उसको strength चाहिए. Think about like a power lifter. Alright, stretching वेचिंग उसको नहीं करना है, ठीक है. And then we go for nucleus pulposus. Over here, this has more type 2 collagen and proteoglycans. Proteoglycans basically वो जो पानी को अंदर लाता है, ठीक है, which is why it's very very viscous, very very like high in water content, and it basically helps to provide shock absorption and also a little bit of elasticity for the spine. ठीक है, तो ये दोनों काम करके हमारा स्पाइन को स्टेबलाइज्ड और थोड़ा सा मूवमेंट भी देते हैं, ठीक है. Hydrostatic pressure is basically something that happens when, so maybe ऐसा there's pressure added to the disc, the inner nucleus pulposus basically tries to push out and gives it more rigidity. ठीक है. You also might have heard of non-Newtonian fluid. Not sure if anybody's heard it, but this type of fluid is like when you sort of try to go and punch it, it is really tough. But if you go soft, it's like really, really, you can just go through. It's like water itself. So think about it like that. So when there's like really hard pressure, the basically the hydrostatic pressure is like it pushes out and makes it a lot rigid. That helps us for our shock absorption and also to protect that disc. Okay. Then this slide is talking about basically how our disc is supposed to stay healthy and get nutrition in because they don't have blood vessels, right? Disc को blood vessel नहीं है तो वो कौन लाएगा, right? खाने के लिए कुछ नहीं है. तो basically what it does is it tries to, it's like a sponge, तो उसको movement चाहिए, right? It relies on us. So when we move, the disc is able to, when the disc gets squeezed, कभी compression हो जाता है तो जो भी अंदर का कुछ भी कचरा वगैरह वो बाहर निकलता है, और जो भी आपको चाहिए जैसा एनर्जी, ग्लूकोज, ऑक्सीजन, वो अंदर निकलता है एट द सेम टाइम, जस्ट लाइक दैट स्पंज जो मैंने बोला था, ठीक है. सिमिलरली लाइक दैट, every time we keep moving, compressing and decompressing, exchange is happening of nutrients and oxygen. Okay, that is the summary. Awesome. Yes, Siddhant has it on the spot. Okay. Now we will go on to what is a herniated disc. Now we understood everything about a disc, right? Now we want to come to the main topic, which is the herniated disc. Now, basically, herniated disc is basically jab. I mean, you can see in the picture. This is a normal disc. ठीक है, nucleus pulposus is sitting nicely inside. herniate में बाहर निकल गया है, ठीक है. कैसा बाहर निकल गया? many ways why, ठीक है. कभी क्या क्या होता है, annulus the annulus fibrosis AF, कभी उसमें ना वो एक कट आ जाएगा, ठीक है. So then the nucleus just like migrates through that cut, ठीक है. Sometimes what happens as we age, this is a normal process, right? As we age, the discs थोड़ा it gets degenerated, right? There's not a lot of collagen synthesis happening, थोड़ा डिहाइड्रेटेड हो गया, थोड़ा दैट वो जो टेंस एसिड मैंने बोला था ना, वो एनिलस को इट्स बिकमिंग वीकर नाउ, तो थोड़ा सा वो माइग्रेशन हो जाता है कभी कभी, ठीक है. एंड नाउ इफ यू विल सी दैट देयर आर मेनी मेनी स्टेजेस, राइट? तो नॉर्मल डिजेनरेशन, तो कभी कभी क्या होता है, डिस्क बल्जेस आर प्रीटी नॉर्मल, मतलब थोड़ा सा ऐसा मूवमेंट किया ना, थोड़ा सा बाहर निकलता है, बट दैट इनर न्यूक्लियस पल्पसेस वो इंटैक्ट रहता है, ठीक है, वो बाहर नहीं निकलता है. But in herniated disc, like if it is too severe, it can cut through that annulus and come out. That is when it becomes a herniated disc. Okay. And it becomes a bigger problem when that nucleus pulposus, वो जो when it is close by to the nerve, अभी आपको वो picture में दिख रहा है, the yellow color is the nerve. If that nucleus pulposus comes out of the annulus, और फिर वो nerve को irritate करता है, right? Annoys him. Where the nerve starts to, obviously it's painful, it's when you feel that numbing sensation, tingling and stabbing pain, this is when it becomes a problem, right? So you would have, now we already discussed कि discs are basically avascular, उनको blood supply नहीं है, तो pain कैसे आएगा, right? There's no pain receptors as well. So if you're feeling pain in the lower back, and if it is a herniated disc, it is very likely compressing a nerve root, which is why you're feeling pain. Okay, because usually मेजोरिटी ऑफ द टाइम्स बहुत लोगों को herniated discs है, पर उनको पता भी नहीं है, बिकॉज इट इज asymptomatic, मतलब कुछ भी symptoms नहीं है, there's no pain, there's no, there's basically nothing that they feel. Okay, that is basically it. These are the four stages and all, we don't have to dive too deeper into that. But yeah, that is basically what a herniated disc is. Okay. Now we spoke about the causes as well. Now I already said that there are many causes. Um, this is one of the things. This is degeneration. So this is also one thing where it's called the calcification of the end plate. So there are some calcium deposits that come under there. Sometimes this can happen also with you know low vitamin D or other with low calcium, for example. So these are all, a lot of issues can come in one single time, and because of this calcification that happens on the end plate. Now we हमने बोला था कि end plate is very important for that diffusion, right? जो अच्छे न्यूट्रिएंट्स अंदर आता है और वो जो भी कचरा हमको नहीं चाहिए वो बाहर निकलता है, राइट? बिकॉज ऑफ दिस कैल्सिफिकेशन वो डिफ्यूजन ठीक से नहीं होता है, इट डजंट हैपन वेरी वेल. बिकॉज ऑफ दैट इज नॉट डिफ्यूजन इज नॉट हैपनिंग, द डिस्क इज नॉट गेटिंग इट्स न्यूट्रिएंट्स एंड इट्स गेटिंग वीकर एंड वीकर एंड वीकर, एंड उसकी वजह से your chances of getting a herniated disc increases. Okay, this is one thing. That is the major cause. Major cause is just that you get old. Okay, now there are many other. Now you can also be smoking, you can also be having a lot of inflammation, just not eating very well, having a lot of body weight. Agar aap obese ho, right, you're already putting so much pressure over there. It's just like breakdown. ठीक है, अगर आपने जिम मतलब 24/7 आप जिम ही कर रहे हो, मतलब you're just training muscle, obviously protein breakdown होने वाला है. Similarly here, if you're constantly you're giving too much battering, even if it is a small tiny amount to that particular area, अगर already it is compromised, मतलब degeneration है, और उसको और there, and you're not giving it enough time to recover, even that can lead to worse and worse symptoms over time. And the second most frequent cause is just trauma. कि you know आग आ गया, वो 200 kg डेडलिफ्ट किया, something just happened. ठीक है, so this is basically just the different types. There are many other types, but we'll just keep it simple for now. This is also what I basically spoke about, smoking and low lifestyle habits, and these are all the expressed, metabolic pathways which sort of express either, catabolic or anabolic pathways, right? Similarly, we spoke about in our osteoarthritis lecture, उसमें भी बोला था कि there's more expression of breakdown, then that is what is going to happen, and there's more expression of building, that's what is going to happen. Now, obviously, we don't see hypertrophy in any of these discs, but basically, there should be a healthy balance of breakdown and repair. Sometimes there'll be more, breakdown when you have all of these bad habits in your life as well, and then that puts additional strain, और फिर वो just doesn't can't handle it, फिर वो herniated हो जाता है. ठीक है. Um, this is basically about the nerve compression. As you can see, this is just an MRI of, a herniated disc, and you can see basically it protrudes out. And sometimes people give it a name of the mushroom, right? It's like a mushroom. It looks like a mushroom basically. So that's what it's also something that is pretty characteristic about a herniated disc. So, like I said, they aren't very vascular. I think we already touched upon this, right? They aren't very vascular. Blood supply nahi hai. So, for the most part, pain receptors are just not there, and you don't feel a lot of pain from herniated discs. If you do, it is very likely caused because of nerve compression, right? The herniated disc, it migrates out, the nucleus pulpus migrates out, and then it starts to irritate the surrounding nerve. Okay. Okay, that is fine. Yeah, so one thing to also touch upon this MRI thing. So a lot of people, sometimes when they do take an MRI, like for whatever reason, um, and then they kind of feel like it plays with your mind. So like always make sure that whenever you're taking an MRI, you're not just taking it just for the sake of taking it. Maybe there should be a reason कि आपका कुछ भी back pain है वगैरह, because it does have a psychological role to also play. Because if you unnecessarily take one, and then उसमें disc bulge देख लिया, और herniated disc है, और this it starts to play in your mind. Now every time you're training in the gym आप सोच रहे हो उसके बारे में, but it was never really a problem for you in the first place, but just because you did it, now you're thinking about it, and now it's playing on your mind. So always make sure that you don't do any unnecessary tests that is not really required. Regular tests are there, but something like an MRI for this state is really not required unless there is something actually bugging you. So just keep that in mind, and even don't ask your clients to just take an MRI for the sake of it. Okay? Even for like a normal back pain, you would obviously, we will talk about, the procedures of, diagnosing and everything when we decide to speak with the doctor and things like that. If there is not really a big issue, there's really no need for you to take an MRI, right? That is also very important. Normal back pain hai, theek hai, we can solve it, so we'll speak more about that. Okay. So basically, where do we see more of डिस्क bulge? मतलब ये जो पूरा स्पाइन है, सर्वाइकल, thoracic, lumbar, हमको ज्यादा herniated discs कौन सा सेक्शन में, कौन सा एरिया में दिखता है? इस मोस्टली द lumbar region, where the L5S1, ठीक है? L5S1 आपने बहुत सुना होगा if you have a lot of clients, and they'll come with ये जो मेरे 2 साल पहले MRI किया था, डिस्क बल्ज है मेरे को, ऑल दिस दे विल टॉक अबाउट, वो L5S1 इज मोस्टली इज गोना बी सेम, ठीक है? बट नाउ इफ समबडी हैज अ सर्वाइकल डिस्क हर्निएशन, ठीक है, उसमें क्या होता है? दैट टेंड्स टू बी मोर ऑफ एन इशू बिकॉज ऑफ सर्टेन रीजन. नाउ जो सर्वाइकल डिस्क है, ठीक है, दे टेंड टू बी मोर थिन, जो थोड़ा छोटा रहता है. इफ यू लुक एट द स्पाइन, राइट, सर्वाइकल में तो ऐसा छोटा छोटा डिस्क रहता है, एंड एज यू गो मोर बिलो वो बड़ा 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 रहता है, ठीक है? मोस्टली बिकॉज the vertebral columns are bigger at the bottom. They're also they go through a lot of basically, I would say they need a lot more strength, okay, basically, because they're always going through a lot of, so maybe it's an evolutionary based thing. So that is why we have thicker discs in that area. Okay. So when there are smaller discs, but in the cervical region, they're also more mobile. Now see, I can move a lot, right? I can move it a lot. If you look at your cervical और lumbar region में mobility बहुत है, ठीक है? पर हमारा जो thoracic है, जो middle में ज्यादा mobility नहीं है. It's just a little bit of flexion, little bit of, but there's a lot in this. So जब भी बहुत ज्यादा mobility है, मैंने क्या बोला था? There's a lot of prone. It's prone. Not to say that it's bad. It's prone to more wear and tear, right? ज्यादा move करने के लिए ना, people get a little bit, maybe they'll do their, Mike Tyson, neck flexions and extensions, थोड़ा वो चल जाता है, ठीक है? So you have to be very careful of that, and they're also closer to the spinal cord. So remember I said that कि जो disc bulge होता है, then the nucleus migrates and touches the spinal cord. Now because the disc is also very very thin and small, it is very easy for even थोड़ा सा herniation हुआ, it kind of irritates the spinal cord or whatever nerve is in or around that area. Because of that, a lot of people with cervical disc herniations, even though it is not as common as lumbar ones, if they do, they have a higher chance of having nerve compression, which is why they'll face more pain. They'll also face a lot of numbness and tingling in the hands of this and the entire arm, because they're all, of the same nerve. All right. So that is one thing to keep in mind. Okay. Uh, so far till that, it's a very short section. Anybody, any questions?
Yes, I have a question.
Yeah.
So, can you please talk about the calcification? How does it happen and what is it?
So, like I said, the calcification is basically just calcium deposits that happen in that area. Now, calcium deposits also, why it happens, like I said, the one of the reasons is low vitamin D. Sometimes your body tries to leach, calcium out of your bones in order to accommodate if you don't have, enough calcium in the body. And then inflammation is also another sort of thing that can contribute to that. But so there are many other this thing we can talk about. For now, let's just, we'll discuss. I think that is something we can do in the future. For now, I think this is it, right? I hope that answers it.
Yes, yes, yes,
Yeah,
fine.
yeah, yeah. I mean, there's a lot of topics here, and thoda sa, we don't want to dive too deep into the symptoms. Now, calcification is also something that may happen in more older people, or it's not a very very common thing to happen for at least a herniated disc, but it is something to keep in mind that it does happen. Okay. Fine. Anybody else? Any other questions? Everybody's good. Just give me a thumbs up. Okay, awesome. Now we're going into the biomechanics, okay, of the spine and what goes through. Slowly, you'll get where we're going at. So now our body weight. One thing to make in mind is keep in mind is that in a normal standing position, जब भी आप normally खड़े हो, your body weight is mostly speaking going to be acting. The gravity is going to pull it anteriorly, pull it forward, right? So that is just something to keep in mind. Okay, that not always, because obviously if you're bending behind, then obviously it's going to be doing that. But for the most part, your body or your spine is more or less trying to counteract flexion for the most part. Just don't think anything more about it. Just यही सोचो कि in a normal standing position, gravity is more or less very commonly trying to pull our body down. मतलब आगे आगे खींच रहा है, और जब हमारा spine is obviously trying to counteract that. ठीक है. Secondly, when lifting, okay, we face many types of forces. Here we have discussed about compression and shear. Compression is what basically compressing something, okay, pressing straight down. Shear is more like this, okay, this sliding shear, okay. um, and so you can see there's a lot of compression and shear, which is one of the two major forces that we basically face in lifting. There are many others also, but these are the two main ones. And you can see that we have also ligaments and tendons and basically the muscles, right? They are basically trying to counteract this for a while. This will all make sense very soon. One thing also about the tendon, right? So not tendon, ligament. We have like two large ligaments to get like posteriorly and anteriorly, which basically hold the spine in place. Okay, that's that. So now what are these muscles, right? That we are basically discussing about, like that they are trying to resist that flexion that is happening. Now, obviously, one of those muscles that we need to talk about is the erector spinae muscles, right? And you can see in the image that we are basically touching upon a deeper muscle and a more superficial muscle, right? uh, the deeper muscle, right, is basically the lumbar spine one. It's called the pars lumborum, right? Very simple, lumborum, right? We can just imagine that it's in the lumbar region, right? The one which is at the bottom area over here. I don't know if you can see the mouse, but it's over here. Okay, now that you can see has a pretty good angle for pulling the spine backward, right? Resisting that flexion, right? Or that shear force, or whatever that's coming in. Obviously, shear force is coming because it's pushing the spine ahead, not down. Gravity is pushing it ahead, right? So there's going to be some shear, so it's counteracting that, right? Similarly, even our this pars thoracis, which is more attached on the thoracic region, is also trying to pull it. But you can see the moment or the angle is not more on this side. It's more like slight to the down, right? More down. So it's basically a little bit more helpful with compression. Okay. And now what happens when you start to go into deeper flexion, right? Basically, when you have these lines like this, and then you go more into deeper flexion, you can notice that it is more now in this direction. So whenever you try to flex, um, your muscles, or spinal, only we're talking about these specific muscles, they don't have enough leverage now to continue pulling or keeping your spine upright. Okay, so they lose leverage, but now they're sort of keeping it compressed, so they're adding more compression. Why am I telling you this? Is this is just one example of showing you how movement and how muscles sort of change and how forces change. A lot of people tell you ki, shear is bad, compression is bad, this is bad, that is bad. Nothing is bad, but you just need to understand that in certain positions, what force may be more or what may be less, because every single person जो भी है उनको herniated disc है, they all react very differently to different forces. किसी लोगों को अगर कंप्रेशन ज्यादा है उनको तकलीफ है, अगर किसी दूसरा बंदा है उसको herniated disc है, if we see there's more shear, usko taklif hai. So if you understand that which positions may have more shear, which positions may have more compression, and you don't have to, like, do all these diagrams and then find out. You just gonna understand, like I just said, right? You gonna understand with the muscles and how they work. And maybe you don't have to dive deeper also. You can just like start taking feedback, which we also dive in deeper into. I'll explain how to go about helping a client. But basically understanding a little bit about how the muscles work along with the spine and everything sort of help you understand what positions may be more vulnerable and what positions may be more safer for people with herniated discs. Okay? So that is just it. But obviously, I'm only talking about the erector spine. Now, or be muscles here, ligaments are there, many other things are there that will also be helping keeping the spine in its position and helping it basically fight forces. Okay? So that is just something I wanted to touch upon. Okay. Now, basically, we're just touching on more or less how the spine moves. Again, it'll make more sense as we move ahead. Okay. So this is talking about hyperextension. जब भी हम ऐसा पीछे पीछे जाते हैं, ठीक है, in into lumbar hyperextension. Basically, there's compression in the between the facet joints, and that is basically compressing the so वो जो disc है. Now, if you're going behind, the facet joint is basically compressing the disc here, and the disc, the tension is lessening over here, so it's becoming more open. So, why am I telling you about this? Is because I mean, obviously, the opposite also happens. So, if you squeeze forward, so you're basically squeezing this area, and now this area is loose. Imagine somebody has a herniated disc. Okay. Now there are many directions वो जो herniate निकल सकता है, ठीक है, anteriorly निकल सकता है, पीछे निकल सकता है, इधर से. So there are many areas it can. Now imagine somebody has a herniated disc वो जो इधर निकला है, ठीक है. अभी इधर squeeze करेगा तो इधर से ही बाहर निकलेगा, और there'll be more, right, because you're adding more pressure, तो वो और भी बाहर निकलेगा. So similarly, imagine somebody has a herniated disc which is herniated anteriorly, मतलब आगे, ठीक है. तो आप पीछे पीछे जाएंगे, so there's more pressure added behind and it's increasing that herniation. So it might be even worse for this fellow, right? Now this herniating is coming, वो जो और वो nerve को root compression को हो रहा है, and और उसको दर्द हो रहा है, right? Now what maybe happen is if he does more flexion, the herniation can go inside, right? Because अभी वो pressure is basically pushing the herniated the nucleus pulposus inside, क्योंकि वो आगे flexion जा रहा है. That also we also see that happening as well, right? So maybe that can be better for him. That is one thing. ठीक है. The other thing to make sure is of कि आपको पता है कि if the migration is आगे या पीछे, आपको पता है, फिर भी it might not be very accurate for you to just decide कि ठीक है, आगे का है तो ज्यादा पीछे मत जाओ, पीछे का है तो आगे ज्यादा मत जाओ, right? It's not the same because sometimes what happens is there may be a little bit of an angle. मतलब पीछे है पर ये साइड पे है या ये साइड पे है. Mostly speaking, it happens behind. मतलब ये पीछे, it protrudes पीछे और laterally, like to the side, not in the center. ठीक है. इसको postero lateral कहता है. ठीक है. That is the more posterior lateral. This is the more common uh, protrusion of the nucleus pulposus. ठीक है. So basically what I'm trying to say is this flexion and extension can influence that disc, matlab, and that can also influence whether it can make the herniation better or worse. But we also can't predict it too easily. So we don't want to rely on this model 100%, but it's something that can definitely help, right? So because we can obviously assume ki if it is coming out from the front, we don't want to do a lot of backing session. But you kind of have to perform that with the client, take feedback, and then understand कि okay, ठीक है, इस position में उसको दर्द हो रहा है, इस position में नहीं हो रहा है, तो we'll stay in this position for now, right? Now we'll move ahead. I hope that makes sense, right? And there's something, okay, there's a thumbs up. Great. Cool. Because nerve is in one side. So the nerve is there itself. The nerve is posterior. Right. Okay. So you can see ये जो facet joint है, right? वो जो, I don't know if you can see my mouse, right, in this area. तो ये जो circle है, in this circle, this is where the spinal cord is. So it is more पीछे. right? Our spinal cord is driving in the posterior side of the spine. So उधर ही होता है, ठीक है? This is just another example of basically rotation, right? Torsion is what we also see. I mean, people only talk about compression, people only talk about shear, but torsion भी है. And that annulus fibrosis, basically it is pretty rigid, so it also helps to fight this torsion a lot, so it doesn't go too much also. But this is also something that does happen, right? And it can also influence the disc in some way. So that is also something to keep in mind. Okay, now let's talk a little bit about, you know uh, now, because we talked about so many, like, positions we need to take, कि ज़्यादा flexion नहीं चाहिए, right? Or we do need more flexion if the person has, you know something in anteriorly, but obviously they have more posteriorly, so maybe flexion is better, right? Do we need to bend our backs more whenever we do some exercise or things like that? But then obviously that is not the very popular thrown out advice, right? बहुत लोग क्या कहते हैं कि back neutral रखो, back straight रखो, right? Even when you're doing certain exercises, अगर herniated disc है तो मतलब और भी देंगे, right? Don't, move your back here and there, keep it rigid, keep it straight, ठीक है? And back then, also, research was kind of playing around with this evidence itself. Is that you can also notice in the chart, as the person sort of like, is he lying down? Now there is absolutely zero, like pretty low load given on that area, right? Shear load, basically. Okay. And then as the person sort of bends more, basically adds more flexion, the shear load increases a lot. Okay. Now, this is just something to recognize that shear load increases. Is that good? Is that bad? We don't know yet. But for now, we know that it increases. And maybe if we want to avoid it, that is why then they gave that advice. Okay, you're bending forward, shear load is increasing. We don't want that. Keep a neutral spine, right? कि anytime you're going to squat, जब भी आप कुछ भी उठा रहे हो, keep a neutral spine. Keep it straight, right? Don't bend it because ज़्यादा shear load आ जाएगा, ठीक है? So that is what the research used to say before. But then, what does it say now? Right? There was this one very interesting study, right? And these are basically just points that I've taken from their discussion of what they found out in their study. So it is not word for word, but it is just moved around, but it's pretty accurate to what they're saying, right? So this study basically found, so stoop lifting is something that people, when they lift, they basically have more flexion in their back, ठीक है? Back थोड़ा round करेंगे, ठीक है? And squat lifting is basically having a full rigid straight spine, ठीक है? And freestyle is doing whatever you want, like उठाओ, ठीक है? नीचे गया है कुछ भी, whatever it is, jungly mode. Okay, so in this case, what they found out that stoop lifting resulted in lower lumbar growth. So obviously the lumbar region over here, the bottom region, when they had more flexion, more curvature, there was lower load on the lumbar area. Total. Okay, we're not talking about compression or shear. We're just talking in total. Okay, and they also found out that shear force, now this is specific, right? Not compression, I think shear, anterior shear force at the L5S1 segment. So L5S1 is a very common site for hernias. All right. At that specific area, only that, actually, out of all the areas, only that L5S1, um, actually bending your back was better. It actually had lesser load than, say, squat lifting. Okay. That was an interesting find. Then, if we look at another point number two, they talk about freestyle lifting, because अभी वो freestyle करके वो सोच रहे हैं ना कि कैसा टेक्निक चाहिए, कैसा वो, तो he just goes and he lifts it, ठीक है? वो जल्दी उठा लिया, ठीक है? And stoop lifting is basically like he's going to bend more and he's taking it, ठीक है? तो वो ज्यादा slow था, ठीक है? Now in squat lifting, you kind of are already in this upright position, so you go down and you pick it up, so it tends to be a little faster. So basically, the results they found out that stoop lifting was very slow or slow. So maybe there can be some differences in that, if in the speed of which you lift the weight can influence some of that load, right? Maybe if you do it slower, we can reduce the load on our joints. Now, we also know and we've also talked about in our biomechanics lecture about inertia and things like that, right? So obviously, when you lift a weight slower, the impact is also slower. The inertial effects are also lesser. So that has an overall lesser impact on your joints. So especially when somebody has a herniated disc. What we don't want is high impact exercises, right? बहुत jumping करना, बहुत भागना, ऐसा we don't want a lot of that happening, right? So always a good rule of thumb is to have slow movements, especially when the spine is involved in it. ठीक है? Slow lifting is probably the best way to go. And the research also says so. And obviously, we biomechan. I mean, we know that it does reduce the impact and the load as well. Now, point number three is squat lifting caused noticeable lumbar flexion, indicating that the spine doesn't remain fully neutral even when asked. So basically, what this is talking about is that in squat lifting, uh, they basically gave them a cue that you have to keep your spine neutral, right? But now we also, I'm sure we all know that the neutral doesn't mean anything. If I show, I mean, we've seen the picture of the spine as well. So abhi spine ka picture aapne dekha, it's basically, it's like this, and the thoracic mein aisa hota hai, fir aisa hota hai. So it already has an S curve, right? कभी भी straight होता ही नहीं है spine. तो people, even when you tell them कि spine neutral रखो, वो कभी neutral होता ही नहीं है, right? Obviously you're wearing clothes and everything you're seeing, but if you have to actually analyze it, कभी neutral होता ही नहीं, कभी fully straight होता ही नहीं. Always some amount of flexion is seen. That is also something to be taken into consideration. ठीक है? The other thing is that they also suggest that the guidelines कि बहुत लोग बोलते हैं कि squat is safer, keeping neutral is safer, stooping is bad, increased load. That is obviously now they asked to be reevaluated, because based on the findings that they found, it is completely the opposite, right? Or more or less somewhere here and there, that we know that the findings are a bit inconsistent, right? कुछ लोगों तो ऐसे बोलते, कुछ लोगों तो ऐसे बोलते. But that is also obvious because there are a lot of variations in differences, like in our obviously in our joint structures, in the way we lift, right? Now there are so many ways you can lift. Like everybody's squat, अगर हम देखेंगे squat mechanics वगैरह, कुछ लोगों को ज्यादा upright रहते हैं, ठीक है? कुछ लोगों को ज्यादा bent रहते हैं. Some people cave their knees out, cave their knees in. There's so much variability, but we're always like focused कि ना squat ऐसा perfect रहना है, ऐसा perfect रहना है. पर सबका अलग अलग individuality है, and that's something we should respect, right? And वो होता ही है. So there's always going to be a lot of variations and individually some differences. So similarly, when we talk about herniated discs cases, we have to be very individual to the client that we are speaking to, राइट? ऐसा जनरल स्टेटमेंट हम डाल नहीं सकते कि ऐसा ही एक्सरसाइज आपको करना है न्यूट्रल स्पाइन रख के, कुछ फ्लेक्शन नहीं चाहिए, ऐसा ऐसा वी कांट थ्रो दैट अराउंड, राइट? वी क्लियरली नो नाउ, वी इवन हैव द एविडेंस फॉर इट, दैट देयर इज ऑलवेज गोइंग टू बी सम अमाउंट of variability. So we need to, obviously we can be a little bit cautious, right? We don't want to have a lot of flexion, a lot of extension, which is, we can understand that much at least. But we don't have to be too scared about मतलब इतना भी curve हुआ तो नहीं नहीं, that's too bad, right? It can vary from person to person. किसी को problem हो सकता है, किसी को नहीं हो सकता है, right? So this is what we also want to keep in mind. So far, from all this biomechanics stuff, anybody has any questions? If all good, please give me a thumbs up.
I just have a question. So you mean to say that we can do squats without, taking care of the neutral spine and all?
Hmm.
Like normally people do, we judge others squats and deadlift, saying that they are doing in the wrong posture and they may end up hurting themselves. So
Yes.
this isn't correct, right?
Yes, that is incorrect. So
Okay.
again, it also has to be a lot of variability, making sure that you are also ready for that position. Ki abhi, now for many years, this person has been, training the neutral spine. Abhi wo, now he's looking on social media ki, now they're showing a lot of, flexion happening. Now he goes and tries it with the same weight. That makes no sense. Yeah, obviously, if he's changing his technique, he has to relearn it, right? He needs to develop strength in different ranges of motion. पर वो जो fear mongering रहता है कि you have to be in that one position itself is not good. But it is individualistic, meaning if this person is seeing negative effects, maybe he has to take it back, reassess, see if that is really something that supports his joint structure. If not, then maybe that's just not for him. If yes, then he can definitely pursue that. So that is definitely one thing to keep in mind. Or the obviously the more interesting thing is that even when people were told to keep neutral spine, थोड़ा flexion होता ही है. So nobody truly has a neutral spine. कभी वो straight होता ही नहीं. It looks straight maybe to us, right? Again with the clothes and everything, but वो थोड़ा flexion is always there, some amount. So that is also something to keep in mind. ठीक है? Can you explain moment arm thing? Are you asking what is a moment arm?
हाय एक्चुअली नहीं, आई एम आस्किंग कि जो इरेक्टर मसल्स हैं वो किस
Yeah.
तरीके से, मतलब जब फॉरवर्ड बेंड होते हैं तो किस तरीके से वो शेयर फोर्स करते हैं, वो वाली चीज।
Okay. So basically, the slide I was talking about, right? In this, what we
हाँ, इन
see,
दिस।
in this, what we see is that in a neutral position, ठीक है? So when we are standing more upright, they're in a position to pull or extend the spine very well. ठीक है? तो जब भी हम आगे जाते हैं, right? In this position, they are able to pull and keep it. Even maybe say in this position, right? I mean, imagine this is our spine. Okay, your muscles are like that. Now, when you're bending, the angle is now not like this. It's not pulling the spine this way. अभी वो ऐसा खींच रहा है, right? Over here. So when you have more flexion happening, these muscles क्या होता है? उनका direction goes into compression, not to bring the spine back. It goes into compression. ठीक है? So they basically lose leverage.
ओके ओके ओके।
Okay, so
ठीक है।
they lose leverage to create extension.
मतलब जब फॉरवर्ड बेंड होते हैं तो इट्स मोर लाइक हमारी स्पाइन ज्यादा हॉरिजॉन्टल हो जाती है और वो पीछे की तरफ खींच रहे होते हैं, कंप्रेस कर रहे
हाँ,
होते हैं स्पाइन को।
compress करा है. So they're not able to handle extension. Okay, with
एक्सटेंशन, ठीक
these specific muscles.
है।
All
ओके।
right. So that is that in deeper ranges of flexion. Okay, that's fine, right? Anything else? Hmm, okay, fine. We'll go ahead. Now we're going to be talking about basically, taking care of someone who has a herniation. Usually they'll be like, oh, surgery. Should you be worrying about surgery? Absolutely not. In the very, very rare case that it gets incredibly, painful, or it's just not working out for you, abhi, matlab, just moving around also creates a lot of tension, then maybe you will have to discuss that with your doctor, right? But for the most case, at least even 90%, and I've also put out a lot of studies based on that. Okay, the first study shows that after 1 year, ठीक है, discontinuation हुआ, 1 साल के बाद they took basically an MRI, and they found out that 63% of the patients had a 30% reduction in the herniation. मतलब ठीक है, back it. 48% of them had more than 70% reduction. Okay, and only 8% showed worsening. Matlab, the majority of the people saw improvements in their herniation after just 1 year. Okay, that, I mean, obviously we don't know what they did and everything, but that is just to show you that you can wait it out. It can heal itself. The second study basically shows pretty much the same thing, that patients with disc extrusion and sequestration. Now these two are more severe ones. मतलब अगर वो जो न्यूक्लियस पपस है बहुत ही बाहर आ गया, right? And extrusion is basically like coming out a lot, and sequestration क्या होता है कि वो बाहर निकल के वो टूट जाता है, ठीक है? It comes out as a foreign object. In these cases, you can see sequestration 96% recovery था. मतलब in the more severe cases, people are recovering better. There's more recovery than if somebody just had slight bulge. अगर bulge है थोड़ा सा herniated हो, कुछ improve नहीं होता है, वो वैसा ही रहता है. But obviously when there's extreme severity, maybe there's more, it simulates the signaling cellular processes, कि macrophages आ जाता है, cytokines आ जाता है. They sort of start eating away the foreign object of the hernia, sort of fix it again, scar tissue बन जाता है. Maybe there's something that improves that over there. But for the most part, the more severe someone's herniation is, they see better improvement. Okay, that was one study. Yeah, the other one is basically something that they saw over a 20-year period. Many studies for LDH is basically lumbar, the lumbar region, where again, which is the most common one. Again, they saw reabsorption. Basically, it goes back in. Okay, 82%, 66%, 62%, and the quality of evidence also was very good, right? Very, very high. And then the fourth study here is 2014 one, which is the prevalence of disc degeneration in asymptomatic individuals are pretty high. So this basically shows that people don't even know that they have disc herniation, right? Even when they do have, and which obviously is a higher rate for older individuals, like I said, because disc degeneration is a very natural process. It will happen, right? How well you take care of your body will obviously reduce. It's kind of like aging, right? Your skin gets old, but if you obviously take care of your nutrition and health and do less bad habits, you will keep looking younger, right? Similarly, depending on that, you're just going to get older. But see, 96% of people had disc herniations when they were 8 years old and above, but they had no symptoms at all. So basically, what this tells you is that you can solve it without surgery, and surgery is kind of like the like with without means conservative approach, right? Maybe they're taking some pain medication, some corticosteroids, some injections are there, right? Maybe to handle the initial part, right? Which maybe it's a bit weaker. It's just happened. Pain बहुत ज़्यादा है, so maybe for a couple of weeks or a month or so, they need some maintenance, right? Maybe like we always spoke about in our injury 101 also, like heat, rice, ice, all of that stuff they may be doing. But after that, it does solve on its own. So itna surgery karane ke liye is not something you want to be looking forward to quickly as someone already has a herniated disc. Okay? That is a last resort what we want to do when something gets too severe. Okay? Especially with nerve compression, right? That is a major issue that happens. So now we understood that the disc herniation is not that serious, but obviously now somebody has an issue. What can we do with it? So before we move ahead, one thing to keep in mind is that movement. Now we spoke about diffusion. Avascular discs are avascular, तो थोड़ा सा movement चाहिए उनको to bring in nutrient supply. So movement is something that can aid hydration, improving hydration. A little bit on hydration, by the way. When you squeeze the disc, because of diffusion, the water kind of dissipates out, right? And when there's a little bit of decompression, the water is absorbed back in. So a lot of people will tell you that you sort of are taller in the morning because of this issue, that when you sort of not issue, I mean, when you're sleeping, basically because there's no like gravity acting and there's not a lot of compression happening, so the discs are able to refuel and get a lot of hydration. So in the morning you're kind of taller. I don't know if that helps anybody, but yeah, that is just something that happens. And then as the day goes by, it does happen again. So maybe in this case here also, maybe having some decompression might, maybe some exercises where there's some decompression, maybe lying down more, taking a rest, may give some benefits over here also to improve hydration in some amount of way. Again, not something that may work for some people. Maybe hanging by a bar is not something that the person is ready for, right? But it is something to keep in mind that to some extent it may help, right? Second thing is that ensure accurate diagnosis, because just because unko lower back pain hai, stabbing pain hai, kuch to bhi hai, it may not be disc herniation. It could be so many other issues, right? Just normal disc degeneration also can happen. Uh, Maybe there's bone spurs. There's so many other issues. So make sure that the person goes to a doctor. Doctor के पास वो गया है, पूरा रूल आउट किया है कि डिस्क हर्निएशन ही है और कुछ is not something that, because if it is, then वो basis पे you have to be dealing with it. ठीक है. Third is obviously exercise, तो हम बात ही करेंगे, but obviously you need to make sure sleep is also taken care of, stress is also taken care of, nutrition plays a very very big role, all of this. Nutrition में I think we have done a lecture joint health पे, so you can definitely go on more that for more information. And lastly, make sure that you regularly change your posture. Simply, like I said, because of movement, right? So, similarly, we want some movement here. We don't want to stay stiff and sit just like that because it can make symptoms a bit worse, right? So, you want to regularly change posture. Maybe like I am been sitting in this posture for a very, very long time now, but I am moving around, right? मैं थोड़ा सा मतलब आगे जा रहा हूँ, पीछे जा रहा हूँ. So I'm not like in this one position. But if I was okay working on my laptop, I would probably keep a phone, थोड़ा अलार्म रख देगा, ठीक है. 1 घंटा के बाद अलार्म है, I'll get up, थोड़ा सा rotation like this, थोड़ा सा movement. Now depending upon how much the person that can tolerate, they can do accordingly. Maybe even walk around, थोड़ा सा move करो, 5-10 मिनट के लिए वापस बैठो, काम करो, ठीक है. Make sure that is happening. Similarly, the person can maybe stand up and work. Maybe if he has a one of those fancy desks, right? It just comes up and comes down. Sometimes if they even have a walking pad, थोड़ा सा movement के लिए, right? They can even use the chair lumbar support, तो वो chair थोड़ा सा ergonomic chair ला सकता है. If they have cervical, then they can keep a neck pillow to keep some protection. So a lot of things can be done to make that position a little bit better if this person is obviously more into the sitting type of job, desk job. Okay. So we have that understood. Now we move on to exercise considerations. Over here, similarly, just like how we spoke in osteoarthritis, very, very similar stuff is also going to be sorted out over here. You want to modify exercises, right? You want to reduce ranges of motion if and when required. Now, majorly where you would reduce range of motion is obviously going to be the spine. Okay, you just have to be a little bit more careful, and to be on the safer side, आपको उसको बोलो कि neutral spine रखो. I know, ठीक है. I know I gave all that lecture about not we're not worrying about all of that, keeping a little, there's a lot of studies showing up, but it is always safer to just start where you just naturally tend to be here, right? And especially when more bending exercises, or like RDS or back extension, you want to be extra careful. So make sure you start slow, right? Don't do any direct spinal loading or anything of that sort, but obviously take it as the person is going forward. Now obviously maybe in the beginning stages, maybe he can't even exercise, ठीक है, वो काम ही नहीं कर exercise ही नहीं कर सकता. So this is what we're talking about in the future. मतलब he now has developed good tolerance, पर कभी कभी stiff back थोड़ा stiff हो जाता है, थोड़ा pain हो जाता है. So in that cases you want to modify a lot of things. So instead of doing the rows and things, we have a chest support, right? Instead of standing and doing the bicep curl में there's a lot of loading on the back as well when you're doing bicep curl. तो बैठ के bicep curl करो, ठीक है. Whenever the person can be seated, whenever the person can take some chest support, anything that's gonna stabilizes the spine can be done. In addition to that, you can definitely have direct spinal loading as well, ठीक है. आगे जाके if the person is good enough, and one of those good exercises are the single leg extension in the quadruped position. I've shown the picture over here, right? Basically you're on force and you can raise one arm up, ठीक है, थोड़ा सा compression it provides the back. You give one leg raise, it maybe increases the compression a little bit more in the lumbar region. And once the client is able to tolerate better, वो थोड़ा और stronger होते जा रहा है, he can go to the third position where एक one leg and one arm he is basically doing, तो वो थोड़ा और compression बढ़ जाता है, ठीक है. You can obviously take this all the way up to a full superman as well, ठीक है, वो पूरा मतलब ऐसा करना है. So that is obviously when he can tolerate it to the max, right? So this is the way you can slowly increase compression on the back. Now, obviously, you want to start with compression because it generally tends to be less of an issue for the spine. But again, it is open to variation. अगर किसी को ज़्यादा problem है compression करने से, तो then you can maybe look for other exercises, right, where it doesn't have a lot of compression, it doesn't have a lot of weight on top of on the body, right? maybe he's holding it somewhere here, or maybe a lighter weight, obviously. And but play around with this. And mostly speaking, compression based exercises, obviously lower load, will be the safer bet. Okay. And that's one exercise I've given, and there's plenty more. And obviously you would want to work around that area. So maybe you can also add some core exercise. Now, in this case, maybe isometrics can do very well. Instead of direct, spinal loading, thoda isometric bhi aap kar sakte ho, right? Planks maybe, but not a full plank, maybe a half, plank, thoda sa asan bana ke, that also can work. But obviously, take consistent client feedback, make sure the person is comfortable with the exercises, and then you can increase the same. Okay. Similarly, joint reaction forces, wherever you can reduce it, do that. That is simply done by reducing the momentum. Okay. That also we've plenty spoken in our previous lectures. So that is typically it for the exercise considerations. Not very difficult. Okay. Now for our final, I think to end the lecture, we'll be talking about sciatica a little bit. That's because it just comes under the umbrella. I also someone asked on the group about sciatica, so we'll just touch a little bit about that. So basically, there's a little bit of wordplay here. Some people, most of the people are basically talking about it being lumbar or lumbosacral radiculopathy, which is basically just talking about in that lumbar or lumbosacral region, there is a nerve issue. Okay. Radi basically just related to nerve, pathy is just a problem. Okay. So over here, technically, it usually happens to be only unilateral because obviously maybe the most common issue is a disc herniation, right? Disc herniate hua, it is compressing the sciatic nerve, तो वो हो जाता है. Now, in some cases, basically what happens is, I mean, in most cases, it doesn't directly hit the sciatic nerve. So sciatic nerve जो है, it basically is over here, this bigger portion, but it basically is formed by from the L4 to the S3. जो भी ऐसा nerves है, it attaches one and becomes one big sciatic nerve. तो जो lumbar जो herniation होता है वो कभी directly sciatic nerve पे नहीं होता है. So some people, that's why they don't say it's called sciatica, they just say कि it's lumbar or lumbosacral because it happens in that region, but it is more or less the same. It's connecting the same vein itself, the nerve, right? So that is there, and it can be caused by many causes. It can be nerve root impingement, and it can be either one of these as well. But obviously, we're focusing on disc herniation, so majorly it's going to be the nerve root impingement. One interesting thing though is the piriformis syndrome. Okay, given the picture here. So piriformis syndrome, you see this red color picture. That's a piriformis muscle. That the sciatic nerve, it is its origination is slightly behind that muscle. Okay, and what happens is that muscle, since it is directly in front of it, sometimes if it gets inflamed for whatever reason, it can do the same thing as the disc herniation. Disc herniate hua, anoikia, the nerve. In this case also, if the piriformis muscle is basically irritated or inflamed, it also irritates the sciatic nerve. This is very rare though, very rare occasion, but it does happen, and sometimes it gets misdiagnosed as disc herniated sciatica, right? But there's slight differences, right? So in this case, that happens. So instead of looking at the spine and everything, we need to work on the muscle in this case, right? Now it is mostly common in runners and endurance athletes क्योंकि वो ज़्यादा भागते हैं. So in case they may be overdoing with that muscle may get start getting overworked. So in that case, it can lead to overuse injuries, and वो थोड़ा सा वो spasms भी हो जाता है. So whenever we have these spasms, so if you see in herniated disc, you wouldn't have those spasms happening, right? Even in this piriformis syndrome, what is unique to it is that if you press around that area, it really hurts a lot, especially in walking uphill, sitting. Now there might be slight, similarities between the two, but this is where you can see a little bit of differences happening. Okay, but this is a very rare syndrome. But I just wanted to touch upon it. It's good to have that knowledge because, especially, a lot of things can mimic certain different um, conditions. So people might think it's a herniated disc, but it's not. So that is just one thing to keep in mind. Okay, and a hernia and a sciatica, whenever it touches, there's a lot of pain that runs beneath that leg. Now it depends also on which nerve, because it doesn't hit the sciatic nerve directly, right? It can be touched upon this L4, this L5, or this S1. You can see in this picture right here, the disc protrudes and it touches the nerve, right? Now sometimes the nerve can even touch in the middle or on the side. So depending on which nerve or which part, it can also tingle some other areas. Maybe not all the way down the leg, maybe only up to the hamstring or up till the buttock area. So somewhere it can have some differences. Okay. Now let's just move ahead. So exercise considerations, very simply put, it'll be more or less the same along like I put for disc herniations. Now in this case, obviously in the beginning, it's going to be very painful. So again, we're not talking about in the beginning here. Obviously, the person will need to go see a doctor. They need to take their corticosteroids, all of their injections and everything. And then once the person is able to tolerate some amount of it, you can start working around that area. Exercise is absolutely fine for someone with sciatica. They can work really well. Even I've had plenty of clients also with sciatica, and they've been able to work really well. Sometimes it does flare up. So especially when you try and stretch those areas, there's a lot of exercises online also that kind of have that stretch, that they emphasize on stretching that area. Try not to do that, right? I don't know why they give that, but try not to do that. Maybe it might help some people, I guess that is why there's a lot of it, but try not to do that, especially things like RDLs, lengthening that area. Be a little bit more careful of that, even though they can do that if they can tolerate it in the future as well. So just work around that area. So if there's a lot of issues in that affected area, train your hamstrings, train all your gluteus, so gluteus medius, gluteus maximus, train all of abduction, adduction, um, calf muscles. You can also train a little bit of abs. So train around that area and make it really simple and to start. Like for example, in this picture, the dude's just holding the chair and just doing a couple of hip flexions. Just picking it up. He can also do this exercise maybe sleeping on the floor, right? Supine position, sleeping on the floor, and just bring like a knee raise, like very slowly. Not to like some people say grab the whole knee and stretch it out. Don't do that. Take it easy. Again, similarly here, take feedback from the client, see how he's working well with it. Simple exercises, emphasizing more around that area will be really beneficial and helpful. Even normal exercise like walking also can help. Obviously, no impact based exercises, no jumping, no running, none of that stuff. Build tolerance with this person, and over the time, he will definitely feel a lot better. Okay, and that's the lecture. So I hope you guys had a lot to learn. If you guys now have any questions, I am open to taking that. Let me know. Okay, we took 1.5 hours. Thought we'll finish it in an hour, but it's okay. Any questions at all? Let me know.
Is it compulsory in sciatica that the pain must go to the leg?
Compulsory? I mean, you're saying all the way down till the leg, like
Yeah,
completely.
means the pain just radiating to the leg.
Radiating is there definitely, and that is one common, but maybe not always. Not for
Okay,
everybody. Yeah. Like I
okay.
said, there are many. So it's from that L3 or L4 to that S3 region. So there are many nerves that innervate from there, and then they attach to one sciatic nerve, right? But each
Okay.
nerve may be having a different function with different muscles. So maybe they might not completely. Maybe if the disc herniation is more in the central region, then maybe it can radiate through the entire leg. But it can vary. It can vary.
What if the pain is localized in that area only on the right side?
No, it's usually radiating, not just
Okay,
it's not like localized, huh? So it's like
okay,
this numbing, radiating feeling,
okay.
that is pretty characteristic about this sciatica.
O-
Okay, that's up. How would McGill Big Three? Who's McGill? Big Three work for the core strengthening. Curl up, slide, planks, bird dog drill. What is the question? Sorry.
So basically, there is a bird dog drill an MC Gill Big Three drill that Dr. MC Gill had come up with. So this drill is supposed to help in the core strengthening,
Mhm.
basically the muscles around your spine.
Mm.
So it helps to strengthen them.
Are you talking in terms of disc herniation, or talking in terms of just in general, like
So
straining your ab muscles?
disc herniations in my lumbar spine. It's in like close to 2 to 3 places. I had
Okay.
got to know about that after I took an MRI. It
Okay.
was long back again, but I had severe back
But
pains during that time. So
okay.
I did these drills and I kind of felt a lot better
Uh-huh.
because it increases stability of those joints a lot.
Yeah. See, any exercise for that matter would work. Right. There's nothing special about these exercises. Yeah, they show they train the core, but it's something to start with, and you can definitely explore
These are
more
simple
flexibility.
basic exercises like, side planks, or let's say even planks would be added into them. So isometric tension they would put on to those joints
Right.
and it would help.
Yeah. See, you're feeling better with exercise in general.
Yeah.
I wouldn't put, like, I wouldn't put just because you did these exercises alone.
Yeah, yeah,
Maybe
never.
in that case,
Yeah,
they helped you maybe, as a low load to start out with. But you can
exactly right.
definitely explore more. You can definitely, have you tried, like, completely, you know,
Yeah,
taking
yeah,
like
I do
math
proper.
pencil? Okay.
Yeah, I do
Okay.
everything now.
Awesome.
Everything now. It's like completely recovered, but then these help me a lot to feel much
Great.
better.
Nice, nice. Then sure, then anybody like watching here also, if they have similar issues in that particular area, they can definitely try these exercises. They're pretty decent. Maybe the side planks, I would take a little bit of time though before.
Yeah, side
Uh,
planks we can start with the basic variations like knee supported
okay.
side planks and all.
Right, right. Yeah, cool. Yeah, those are pretty good. Those are pretty good.
Thank you.
Yeah. Anybody else? I think we'll wait till 11:30. Any questions? It's a pretty heavy topic. I know. So feel free to just text me as well afterwards if you feel there's anything that you was not able to grasp. I will definitely help you out after class as well. Don't worry about that. Cool, then I guess you guys have no questions. So I guess that's all. So I thank you guys for coming to the lecture. Hope you guys learned well. If obviously if any other new questions come up in the future as you're thinking about the lecture, maybe you want to watch it again, get maybe more questions, feel free to just text me and I'll be more than happy to help you out. All right, then yep, you guys have a nice day then. Take care.